Hi, can I help you?
Yeah, can you help me find something for diaper rash?
Sure. Well, I'll be glad to help you, but I need to ask you a few questions. Is it
Oh,
right if I take a couple of minutes of your time?
sure.
Okay.
Yeah, that's fine.
Okay. Please have a seat in the room, and I'll be right with you after I close out
Okay,
this order.
alright, that
Okay.
sounds great. Thank you.
Thank you. Hi, my name is Tron. I'm a pharmacy student at the University of Charleston School of Pharmacy. The reason for this counseling is ensuring that the medication I recommend match your situation and inform you on the adverse reaction and provide proper treatment procedure in order to maximize the outcome.
Okay, thank you. That's great.
First, may I ask who is this medication is for?
It's for my daughter. She just turned 2.
Okay. What is wrong with you, daughter?
She has a rash on her butt.
Can you describe as another symptom of this rash?
It feels scaly and she has a slight fever.
Can you tell me more about the characteristic of the rash?
When I checked her, she seems sore on her butt and it looks red and tender.
Have you noticed anything unusual?
Last night I told her not to scratch, so she was rubbing her butt against the wall.
Did you try to loosen the diaper?
Yeah, I kept it loose.
When was the last time your daughter has this kind of rash?
Oh, this is the first time.
How much powder do you apply each time you change your diaper?
Pretty sparingly, just enough to keep it dry and smooth.
Have you tried anything else before looking for medication therapy?
No, I didn't want to risk it, so I came straight here.
Okay. Well, since when did you notice her complaining?
Just yesterday, her skin looked normal then.
Okay. When did she hint again that she's having an issue?
She pointed to her diaper about 2 hours ago and asked me if she could scratch it.
So how often do you change your diaper?
About at least twice a day now. I always make sure I do it before she goes to bed.
Okay. I believe it rained last week. Did you dress her in any plastic clothing?
Yeah, actually, I put her in her rain suit when I took her to her grandparents' house last week. Is that a problem?
Yes, it might, because wearing plastic pants might cause moisture to build up in the diapers.
Oh.
Okay, yeah. Where is the rash located?
It's the bottom right side of her butt, by the fold.
Let's see. What worsened her reaction to the rash?
Pretty much when she sits down or lays on her back or when I carry her.
Let's see. So what, have you done anything to make her feel better?
When I change her diaper, I apply some baby oil.
Is she on any medication?
Nothing since Christmas.
Okay. Is she allergic to any seasonal or medication like zinc oxide?
No, not that I'm aware of.
What about food allergy? Is she allergic to it?
No.
Okay. Can you tell me something about her health and maybe her social history?
She's pretty healthy. The doctor says she's growing normally and not lacking any nutrients. Neither of us smoke or drink, so.
I think your daughter has a mild rash from the moisture buildup and the rubbing of the affected area over time.
Okay.
So with her condition, I recommend that you use zinc oxide ointment to treat her rash. The active ingredient is the zinc oxide in there. This medication is known to treat diaper rash and mild irritation. It is recommended that you change wet or a soiled diaper promptly, okay, and clean the diaper area and allow it to dry first. Okay, it's an over-the-counter medication, so you don't have to. It's not required to refill, and you can use it. And you don't have to worry about missing out on the application. And when you apply it, just apply it liberally as often as necessary with each diaper change. Okay, especially at bedtime or any time when exposed to wet diaper, maybe for long.
Okay.
Okay, and make sure you store the medication about room temperature. It's about 68 to 77 degrees Fahrenheit.
Okay.
If you use to the Celsius, it's around 20 to 25 degrees Celsius.
Okay.
Okay. Stop use and call the doctor if condition worsen. Okay, or the symptom lasts more than 7 days, clear up, but then it come back in a few days.
Okay.
This medication is external use only. So when you apply it, when you use the product, make sure you don't get into your eyes and keep out the reach of your child.
Okay.
Okay. If swollen, get medical treatment immediately, or call the Poison Control Center, and the number is listed on the box.
Okay.
The common side effect for the medication is skin sensitivity. So if the skin develops any sensitivity, any more itching, then please come back or see me, and also call your primary care physician. Okay. Before concluding our session, can you tell me some of the instructions and uses this medication so that I know you're aware of what to expect and what to do?
Okay, so it's an ointment, and I apply it every time I change her diaper, especially at bedtime or anytime it's a wet diaper. It needs to be stored at room temperature, and it's only for external use, so make sure to keep it out of reach of other kids that might be around, and don't get it in our eyes. Stop it and call the doctor if symptoms get worse or last more than 7 days.
Yes.
Okay.
Great. Thank you for your time. Please come back in 2 to 3 days and let me know if the symptoms get better or got worse.
Okay. Thank you so
Thank you.
much.